Hello, my name is Lucas Brannon, and this is my webinar on broken clavicles. The anatomy of the clavicle is that it's commonly known as the collarbone. It's classified as a long bone, and it's visible under the skin. The purpose of the clavicle is there's three of them mainly. It attaches the upper limb to the trunk as part of the shoulder girdle. It protects the underlying neurovascular structures supplying the upper limbs, and it transmits force from the upper limbs to the axial skeleton. There are three main sections to where the clavicle breaks, and the first one is in the lateral third. There's 15% of fractures occur there, and in the middle third, there's 80% of the fractures that occur there, and only 5% of fractures occur in the medial third of the clavicle. So causes of injuries, there's four main ones. There's falls, such as falling onto your shoulder, onto your outstretched hand. And there's sports injuries, which is very common in many sports. For example, football, from a direct blow to the shoulder or landing on your shoulder. And also car crashes can also commonly cause clavicle fractures as from the force that occurs from them. In infants also can fracture their clavicles when they're born, coming out of the birth canal. And that's very common because their bones aren't fully developed and they're still quite fragile. And when they come out, then the clavicle will sometimes break. So symptoms of breaking a clavicle include pain that increases with shoulder movement, swelling, tenderness, bruising, a bulge on or near your shoulder, a grinding or cackling sound when you try to move your shoulder, stiffness or inability to move your shoulder, and newborn children will often not move their arm for several days following a birth-related collarbone fracture. Treatments of a collarbone fracture are, the most common way to treat the fractures is with the immobilization with either a sling or special bandage called a figure 8 splint. Another way of treatment is pain relief with cold therapy and pain medication. It is recommended that you ice the fractured area for 15 to 20 minutes every 2 hours for as long as necessary to decrease the pain and swelling. There are some complications that can come with a clavicle fracture. The first one is a nerve or blood vessel injury, and what happens there is the jagged ends of a broken collarbone may injure nearby nerves and blood vessels, and if this happens, you need to seek immediate medical attention if you notice numbness or coldness in your arm or hand. Another complication is poor or delayed healing. A severely broken collarbone might heal slowly or incompletely. Poor union of the bones during healing can shorten the bone. Another complication is that it can leave a permanent lump in the bone. As part of the healing process, the place where the bone knits together forms a bony lump. This lump is easy to see because it's close to the skin, and most lumps will disappear over time. Another one that occurs is osteoarthritis. This is a fracture that involves the joints that connect your collarbone to your shoulder blade or your breastbone, and it might increase your risk of eventually developing arthritis in that joint. And the next part is the healing time. In adults, it takes 10 to 12 weeks to heal, but for adolescents, it can take 6 to 8 weeks to heal. And children under 8, it can take as few as 4 to 5 weeks for the clavicle to fully heal. There are some recommended exercises for a broken clavicle, and the first one is a shoulder blade squeeze. And what you do for this one is, while standing with your arms at your side, squeeze your shoulder blades together, but do not raise your shoulders up as you're squeezing, and then you're supposed to hold it for 6 seconds and repeat 8 to 12 times. Another exercise is wall angels, and for this, you start this exercise with your back against the wall and your hands raised above your head. And then keeping your arms against the wall, you bend your elbows and slowly lower your arms while squeezing your shoulder blades together. And you repeat this 8 to 12 times. Another example of an exercise for rehab is shoulder flexion, and this is the individual will lie on their back, holding a wand with both hands, and your palms should face down as you hold the wand. And you keep your elbows straight and slowly raise your arms over your head until you feel a stretch in your shoulders, upper back, and chest. You're supposed to hold this for 15 to 20 seconds when you feel the stretch, and repeat 2 to 4 times. And the picture here is an example of the shoulder flexion exercise. Thank you for listening to my webinar on broken clavicles.